This program is brought to you by Colgate. Brush twice a day for strong, healthy teeth.
Welcome to Simpson at 8. The battle to contain the COVID-19 virus from spreading in Fiji continues. And joining me to break things down about where we are, what we should do, and where we could be heading is one of the leaders of the nation's fight back, the Health Minister, Dr. Ifereimi Waqainabete. Thank you for joining me on the show.
Thank you, Stan.
All right. So, latest update, 368 tests, 5 confirmed, and we're doing this interview in the morning because this is the only time I can get hold of you in your busy schedule. So those are the latest numbers. What do the numbers tell you?
Nothing much, because if you've seen what's happening around the world, there are countries that were in similar situations with 5 cases, and over a month they certainly sprang up in terms of the number of cases that they had. So in a way, we can tap ourselves on the back and say 7 days it's gone and we haven't had a new case, but really that doesn't mean anything in the whole scheme of things. The whole world is in a fight at the moment. It's a war against COVID-19, and no country can say yet that they've overcome this beast of the virus of COVID-19.
So zero complacency.
No zero complacency.
So we must keep the fight going.
Keep the fight going, Stan.
Until, and then we'll come to when do you think we might be ready. But so let's talk about these tests, because there's been a lot of questions around it. How do you decide who to test?
So there are guidelines around who to test, and usually that's given by advice given through WHO. That advice is almost all the countries that have the ability to test with a WHO reference lab, such as ours, follow the advice. So certainly when you have clusters, so we've had 2 clusters, and how it's imported into the country. So you test those who have been contacts of the imported case who have symptoms. So that in itself is the most important. The other thing that we've done is we've then gone beyond that in also testing those who appear to any of our 3 divisional hospitals or 3 secondary to tertiary level care hospitals, so CWM, Lotoka and Labasa, who also have respiratory symptoms of concern. So even though they may have a pneumonia, and we test them anyway.
Just to be safe.
Just to be safe.
So these 368 make up the people who are around the patients, around the clusters?
Yes.
And the people who came in you thought have the symptoms?
So anyone who's come in from countries, from any country around the world, and through their time of isolation they develop any symptom, we do test them. We also have to be mindful of the fact that we are visiting them on a regular basis, especially those who had direct contacts of the first 2 cases. And as alluded to before by Dr. Alicia, Dr. Chemesa, and also in the statements made, that with the first cluster there was about more than 300 contacts that we are watching, and with the second cluster, which is the super case, there are 12 contacts. Okay. But again, as I've alluded to, apart from that, those who have symptoms... So
the first cluster is quite a major one, 300 contacts and counting. We'll come to that. But I mean, could we or should we be testing more?
We're testing as much as we can.
When you say as much as we can, what is it about ability to test, or?
Yeah, I mean, we have the ability to test. We can test
up to how many?
Up to around 60 a day if needed. But certainly at the end of the day, we want to be sure that we're actually testing those that we believe are actually moderate to high risk of having the disease.
Because I asked that question because I see a lot of people asking, why are we not testing everybody? Why are we not, and again, this is new to many people. So a lot of people asking, we should be testing the whole country to see who's get it. Because they're saying, there's the word people who may have the virus but are asymptomatic and walking around as normal. How do you address that?
That's an important, that's an interesting question. So let me take you out of Fiji. New Zealand has 4.7 million people, and I can tell you that they're not going to do 4.7 million tests. Australia probably has about, 20 million people? So are they going to test 20 million people? So that's
It
the
doesn't make
question.
sense.
So that's the question I put back. America has 350 million people.
So you're saying it's
Yeah.
not practical?
Well, let me finish. So this is a time when I can actually keep on going. So America has 350 million people, and it has a lot more challenges around COVID-19 than New Zealand has, Australia has, or Fiji has. But I don't think they're going to test the whole 350 million people. You're going to test as much as possible those who are in the risk category. That's important to test. Also remember that this virus, when you test people and they don't have any symptoms, there's a very, very, very high likelihood, maybe above 95% to 97%, that they will be negative. And then what will happen then is you give that person a false sense.
A clear, but
Yeah.
he could be actually getting it later.
He could get it later. So when
Or
he
she.
does, or she get it later. So when the person does get it later, they will say, okay, let's test you for COVID-19. They'll say, no, but I already had the test. So that's why the guidance has been in testing those who have symptoms, and especially those who have direct contacts to your imported cases.
All right. So I hope that clears things. You don't just test everyone. You have to stick to the clusters and the people that
Because
show
you'll
the
have a lot of
symptoms.
negatives.
Because you will get a lot of negative,
Yeah.
and it'll probably be a waste of test.
Yeah.
In many ways.
Well, you
yeah.
can turn the numbers around. So you can turn the numbers around and say, so for a country that has 3 million people, and they have 10 positives, you can do 3 million tests and just end up with 10 positive. But what it also means is that if some person within that 2.9,919,000 accepted 10, if any of them actually has symptoms later on, then they have a false sense of belief that they are negative because they've been negative before. So that's why the test is only done when somebody is symptomatic.
Okay. So let's talk about the testing process, because this is something. Please carry on. Have your coffee. To test how it's done, because this is not just a normal testing process like how you go and get a blood test. I mean, in fact, I saw some people even stating, blood test. This is not how you do the COVID-19 test. You don't take it through blood test. You take it through swabs. Yes? But can you outline for the people listening in how the testing process happens?
Okay,
What's involved?
So any test that's done to test for the virus or any bacteria of concern, the test is done in such a way that you get a good yield. That's the most important. So when the person is symptomatic, then there is enough virus that's running through the body to be able to be picked up by the molecular lab. So that's one. So the other thing is you've got to test something that's likely to have the best yield. And the way that they've designed it, the experts that have come up with the test, the best way to be able to test it is this virus actually goes and lodges in the nasopharyngeal right at the top here, and before it heads down. So it stays there for a few days before it heads down. Even when it heads down and starts getting into the pneumonia, there's still a yield of virus that remains in the nasopharyngeal cavity.
At the back.
At the back. So that's why there's a long swab that's put through, can be put through the nose or through the mouth, ideally through the nose, and it's swabbed right at the back because that's where the most yield will be.
Wow.
And again, there's some body of evidence to actually suggest that if you take the yield from the back as opposed to the blood test, so for example, you don't do a blood test, but the yield at the back has the majority of the virus as opposed to taking a sputum, taking a saliva, or taking other form of test.
But those are also options for doing the test.
They're not an option because they don't have the yield.
The yield is there.
The yield is at the back. So it goes and rests there.
So generally it gets, you get a swab put through your nose,
Yeah.
and they get a swab from...
Or right at the back.
At the back.
I mean, I've worked in this area before. I can tell you it's a very uncomfortable thing to get a test. Not a nice thing to do. So right at the back, it's quite irritating. God has designed it in such a way that it's got a lot of mucous membranes, quite sensitive, because when you have stuff at the back, you can cough it out, you can sneeze it out.
Right.
And that's why people who have this problem with COVID-19, their symptoms can be early as sore throat, they can be sneezing, coughing, because of the irritation on the mucous membranes. And so the body actually reacting, trying to actually push it out, and that's why they behave as such.
All the more reason why people really should follow the advice from the authorities. But I wanted to ask, so it involves that very uncomfortable process, and when do you do your testing? I understand you do your testing in the evenings.
So certainly when somebody is identified as needing a test, fitting the criteria, our staff go over, do the test, we accumulate all the tests, and usually our staff actually run it. So they run
So
it.
the test is just done in their homes or in the, they have to be brought in?
And ideally done in a hospital setting.
Right.
Sometimes because of geographical location, it can be done at their home, whilst they're bringing the patient over to an isolation facility, and also waiting for the test result to come out. So they're tested. Once the test is done, it's all accumulated, brought towards the Fiji Center of Disease Control. Now, remember, Stan, that at the moment we're testing people right across the geographical divide of Fiji. So you get tests that are coming from Lambasa, tests that are coming from Lotoko itself, because we've had contacts within that area. They have developed symptoms, and thank God, so far none other has tested positive. So the tests are coming from there, Nandi and so forth. So all that comes together, and then the test is run in the afternoon, early evening.
All at once?
Yeah, all at once.
Together.
So put them all together and all at once, and then they run it throughout the night, and they go through the validation process, and and usually around about midday is when we then come forward with what the results have been the day before. And systematically, we have a really nice rhythm about the way we do things, about the way it is being done. Because certainly at the end of the day, one of the major blessings that we have at the moment is that the fact that government has been investing in the Fiji Center for Disease Control. So we are one of the only 4 countries in the Pacific that have the ability to do this test. And I think this is important to understand. So Guam has it, but Guam has the support obviously of America.
Of the United States.
And then you've got French Polynesia and New Caledonia.
So we are the only independent country you're saying that has this in the Pacific?
You said it.
I'm interpreting what you're telling me. Now, this test, the 360 odd people that have been cleared, 363 because 5. So how many times are they tested before they're cleared? So when you say it's negative, how many times do you that you can confidently say that they're negative?
When I say that they go through a validation process, once we say somebody is negative or somebody is positive, we are very clear on that. And the other thing that's happened is, because to be a reference lab, initially we had to send. We had a lot of validation process that was happening. So they had controls that they tested. We also had to make sure that we met, very strict guidelines. And then the first 5 tests we also had to send over to Melbourne to validate. And all 5 were in concurrent. So all 5 cases were concurrent without testing. So really that's actually showing that we have an integrity around our testing process. But more importantly, that when we call a positive or call a negative, it actually is a true positive and also true negative.
All right.
Now, that's important to understand, because there are a lot of people that have reached out to us and say there's a test being done by a certain country, there's this test formed by a company, this test done by a company. But all these other tests that haven't been validated have, for example, WHO acceptance or FDA acceptance. These tests may have a high false negative or high false positive. So that's why we're not jumping the gun to try and get those tests.
Right. So when you say negative, you're sure it's a negative?
It's negative, it's a negative.
Can someone be positive after being tested negative and cleared?
Very small.
Sorry if that sounds like a stupid question, but it's a question.
I've just said the answer before, Stan. And the answer is very simple. If you test somebody and they don't have any symptoms, they're very, very likely to be negative. So that's why you don't test people. We currently don't test people who don't have any symptoms. When they develop symptoms, they have a yield of the virus at the back of the nasopharynx that's enough for the molecular lab to be able to move from there,
right,
and get a positive result.
So that's something we'll have to get our head around, and then we're starting to understand. Obviously, it's a whole new thing. Now that we've had this confirmed, we haven't had a confirmed case now for 7 days, and some are beginning to ask, to question the soundness of our test, which you've just described, like if they're strong, if they're credible, you've addressed that. Some say this is too good to be true. If all the other rich countries with better facilities are having all these numbers, how good is the quality of our test and our testing process? You have described it. So for those that have doubts, how would you tell them how sound, how credible is our test? You mentioned that it's WHO and FDA compliant.
Stan, I think the most important thing to understand here is we test people. So people are the petri dish. People are they take the virus. Okay, so if there is a person who has the virus, who has symptoms, and we test and they're positive, then that's the next case, for example. So it's people. So what we also know at the moment is that we have clusters that are imported. So we have an imported cluster. Somebody imports the virus because inadvertently they didn't know that they're carrying the virus. And then they become the cluster. So we worry about the context. So it becomes a tree, so their context. And if one of the contexts become positive, then their context. And so that works its way down the line. I think we have to understand that the strategic measures that government has put in place in terms of the restrictions that began with foreign nationals coming in from other countries that began slowly, and then certainly reach a stage where we're then asking people to actually self-isolate and self-quarantine. Those are all important measures in being able to minimize the likelihood of importation of the case of the virus, but more importantly, if it's important, to try and minimize the community transmission. Now, if you look at some of the countries and their graphs, what it is showing is that quite a lot in the initial stages when they had the graph go up was because of the imported cases. So people returning back into their countries. And some were returning back because they had, your country is going to close its borders and this day. So they're all rushing back into the country. So when they rush back, these people, they didn't realize inadvertently that they were, were carrying. So they brought it back into their countries, and numbers went up, and they were interacting with other people. So then community transmission began. So I think going back to the thinking around the test, we have to remember it's not only the test. I've talked about the layers that are in place. We have to understand that it's the person, who may be carrying the virus and doesn't understand. That's why it's so important that we follow the measures that are in place. Those who have come, the week before, before we started using the government-designated facility, they've been asked to stay in isolation, isolate themselves, self-quarantine themselves for 14 days. That is very important. Because if they do have the disease, then they're not giving it to others.
So coming back, our tests are international, standard, world-class. It's the process that everyone else is doing.
Yes, you said it.
Well, I'm trying to reaffirm that. So, our testing kits, because this is another story that's going around, and I really want to clear all this. People, there's seeing reports around the world of faulty testing kits that had to be returned. Our testing kits, where do we get our testing kits and our testing systems from?
So we use a WHO recommended supplier, and we know it works because it's a WHO recommended supplier, and that's why we know it works, and we work around that. So that's I think that's the important thing to understand. I think just to close the whole discussion around the test. The test is the best test is, and we are blessed to have the test because the investment gone in. There's nothing more. You cannot over-test that test, and that test never under-tests.
So people should be have confidence in the numbers that you put out, that it's gone through the mill. And we having the international standard WHO, I don't think you can even get better than that if they've affirmed
Stan, I think the most important thing is we shouldn't be looking to the test to declare somebody positive. What I'm trying to say is, if you know somebody who's in your family, who's come back recently, and should be in self-isolation, that person is positive until proven otherwise. Do you understand? So that person should be in self-isolation.
So guilty until proven innocent.
You should. That's the way we should treat them. So you are in self-isolation. You are there until proven otherwise. My son is in Japan. He asked, "Dad, can I come back for 2 weeks and I go back?" I said, "You come back. You're in a hotel for 14 days. You're going back. We're not seeing you." So he said, "Dad, I'm not coming back."
That's good to be the
So
attitude.
the worry that I have is people are thinking, okay, it's okay. We can break the rules because we can ask the government maybe to do a lot more tests. If that's the thinking, I'm sorry to say this, that's not the way that's going to limit the spread.
This is how we're going to hit the bad situation on our hands.
Yes. The only way to limit the spread is to practice social distancing for people who've returned back to self-isolate because they are carriers until proven otherwise. That's the way we need to think.
Okay, so those you've mentioned that. I think that's getting a bit clear to people. It's getting clear to me now. Those have been found negative, they still kept in isolation for 14 days.
Yeah.
Yeah, so, and what are the conditions like in those isolation? I mean,
So they're different. So, for example, the direct contacts of the two patients are in the isolation facility within the hospital, so Nabo and Notok Hospital, and we look after them very well. As I've alluded to, I mean, with those, 5 patients, the doctors and the nurses are working with them. We at Ministry of Health headquarters are not in contact with them, nor are we in contact with the doctors. Whatever we ask them, every day, is the patients doing well? The patients are doing well. That's what's taken. That's what's actually put out in the statements.
Right, yeah.
So I think that's the first and foremost important thing. The other thing that we have to realize is that apart from that, then we have a government designated funded facility that government has just has been going on ever since the end of last week. So those who have been coming back, because there's been people rushing back into the country because we effectively, because the airline industry is not moving anymore. Australia and New Zealand have closed their borders. And we've also limited people coming back and closing our borders per se. So they've rushed back into the countries. They've been put in government-funded designated facilities. So they are there. But on top of that, we also...
So now we're managing that isolation.
Yeah. So then our people are also moving ahead in terms of creating isolation facilities within every towns and cities and every division. So that has to be available. That's also on top of the isolation units that we have in every hospital that we have in the country. So every hospital has its own isolation unit that I've been talking about. Because, say for example, somebody, turns up in Moala, where I come from, and there's a worry that that person can be COVID-19. Moala must have the capacity to actually isolate that person. So every health center, every subdivisional hospital, every hospital has their own isolation unit.
So isolation conditions are different for different places generally, but I mean right. So those that have been confirmed, the 2 in Nandi, 2 in Lautoka, 1 here in Navua, you have stated that they're in stable condition. So when you say stable, what does that mean? I mean, because they obviously they have the virus. When stable mean that is having symptoms of the COVID-19, like flu-like symptoms? Are they? I mean, have any of them needed ventilators? I mean, what is defined stable? So
when the doctors say that they're stable, that means what we can deduce from there is that they're relatively well wherever they are. They're not needing a ventilator. That's all.
They're not needing a ventilator.
Yeah, I mean that's what it is.
So very quickly before move on to another topic, the issue of ventilators. We have, how many do we have, and do we have enough?
So with the ventilators that we have in the country at the moment, plus the anesthetic machines that we have available, if we needed to, and then just run emergency operations in all the 3 hospitals, we have 50 ventilatory devices, more than 50. On top of that, with the budget of 40 million that government has put aside, the Fijian government specifically for COVID-19, we're getting another 50 ventilators. Now, if the ability to actually ventilate 50 people, then the ability to actually ventilate another 50 people brings it to 100. So basically means everything else stops. So non-essential surgery stops. Only essential surgery happens, and we just concentrate on 100 ventilators. With that capacity, we are punching well above our weight in terms of the size of the country and the ability to provide ventilation. But again, I keep on saying this, Dan. 1 million ventilators is not going to solve the issue. Again, going back to testing. Widespread testing is not going to solve the issue. 1 million ventilators is not going to solve the issue. What's going to solve the issue is responsibility and leadership. Okay. People need to say, this is how I need to actually stay at home. I need to social distance. We shouldn't be relying on testing to cure us.
And be lulled into a false sense of security.
We shouldn't.
Yeah. Even though we've done well to be not have...
That's exactly, Stan, the reason why a lot of first-class high-income countries really struggle. Because the people thought, and they were right in thinking at that time, that we have a great healthcare system. We are number 1 or number 2 or number 3 in the world. And that will be able to look after me if I get sick, or I shouldn't be able to get sick because we have a great healthcare system. Look what's happened.
Yeah. They're struggling now.
Yeah. So we shouldn't be based on a test. It shouldn't be based on 1 million ventilators. It should be based on each and everybody's responsibility. We as a Ministry of Health and the government, we have a responsibility. We've done that. So government has actually set aside a supplementary budget specifically for COVID-19 in terms of strengthening the health system so that we can be able to carry on with our normative function and tackle COVID-19 with the 40 million that's been set aside, apart from the 3 million we poured in, but also supporting everything that indirectly affects health, so supporting those who may have, lost hours at work, supporting those, for example, businesses that need to be supported, because indirectly, at the end of the day, it all helps. So with the economy, with health, and so forth.
That's right. Let's move on to the lockdown. This was a lot of talk about could we have closed the borders earlier. I think we've crossed that bridge. I'd like to focus now on that. We locked down Lautoka, not Nandi and Viti Levu, even after the confirmed case in Suva. So Lautoka remains your area of concern. So let's focus on that. What continues to concern you in Lautoka?
So at the moment, then, beginning this morning, there are 30 teams of health and civil servants, doctors, nurses, other health staff, health inspectors and other health staff moving throughout the communities within the containment area of Lautoka. And just moving throughout, going street by street, suburb by suburb, mobile fever clinics, talking to people, just trying to find out if we are missing, there's a stone unturned in terms of a community transmission of the virus. Because certainly we've had, one case, and then we've also had, direct contact that came in contact. So that's why they're moving right throughout that area, and that needs to be done. That needs to be done because within the Lautoka area, there was, I believe, around about more than 100 contacts within the Lautoka area. So that's why it needs to be done. It needs to be done collectively, comprehensively within the Lautoka area. And the word that the experts are using is to actually just flush Lautoka. So if there's a virus somewhere, we will find it, we will deal with it, So that's the whole aim. So it's not about just extending it for extending its sake. There is a reason for it. There's a scientific reason for it. And even though there's been discussion, you have an incubation.
So there's a system or a model that you're following for Lautoka?
Yeah, certainly. You've got some brilliant minds working at the Ministry of Health that's putting things together and giving proper advice to government, and certainly there are health staff, doctors, for example, other health professionals that government is invested in terms of their training, going overseas and coming back, and so they are coming to the fore and giving that appropriate advice.
So I mean, their advice is this is needed to be really to get this going. Eh? Now, obviously, the focus on Lautoka emanates from the concern with patient number one, and you brought him up publicly quite a bit, and there's been some criticism about how he's been raised. You mentioned him in Parliament. You mentioned him in your statement again yesterday. So you stated that there are gaps in his story. So in many ways, you've just said that. You said you can't trust him. So the question for many people is, why have you made the decision to say this so publicly? Because the question is like, this is causing fear, because things that you vilified him, you've caused stigma.
Yeah, no, we haven't actually named this patient, nor have we said who this person is specifically. I think that's one thing.
People know who.
Yes, I mean, if they know how they know the person, whether it's through social media or whatever, and we don't know the person personally. What we do know is what we are given, and what we are given is, these are the issues surrounding this person. And also Fiji Airways, the statement that was read in Parliament was a statement prepared by Fiji Airways. Not my statement, not something given by doctors, nor was it given from his folder. So I want to make it very clear. That was a statement given by Fiji Airways. In terms of the breaches that happened, they may have contributed to this.
So you still respected the patient confidentiality?
Oh yes. At the end of the day, the patient's confidentiality remains. We keep on making sure
but some would say it's a roundabout way of saying what he didn't do or did do.
Whether it's a roundabout way or direct way or whichever way, I think the most important thing to understand at this point is this is a public health emergency. And it's important to get the relevant information so that those who may be at risk understand that they are at risk. You know, so these are not normal times.
And the dangers that could be
and
caused
the dangers
by
that could be caused.
Yeah.
Remember that we've got somebody who's not related to the patient, that they have met in another surrounding who's tested positive. So I think it's important to understand in the public health emergency, there are certain facts that needs to be released so that we can be able to get the appropriate people who are at risk to be able to front forward, and so that we can move with it. That to an extent was also what was done in terms of the printing, the putting out of names of individuals who may have been in contact, who came back on the flight, because you know for 3 or 4 days we were using all the mechanisms that we have within government to be able to find certain people that we're not able to find, and we couldn't find them. Once that went out, within 48 hours we got everybody that needed to be accounted for. There were certain institutions that we were trying to get information from, because we knew certain people that had traveled with the first case may be in that place or work in that place, for example. We're trying to get through to them. They wouldn't offer any help. As soon as the names came up,
we found them.
We found them. They offered it. They said, look, we know where you can find them. And what concerns me is that we need to understand that we all have a responsibility of duty of care, because it's about saving lives.
Right.
You know?
So you're saying the public good outweighs
so it's
the
about
individual rights at this stage? Or?
No, I haven't said that. What I'm saying is, what is very important, that we make the important right decisions to save lives, which also includes the consequential bill. So the public health COVID-19 bill that's been passed in Parliament. If you look at it, it says up to 5 years plus or minus 10,000. Because we view this is very important in being able to stop the propagation of the virus. Because at the end of the day, government can only do so much, you know. Ministry of Health can only do so much.
We mentioned about people are the key people here, and if they're not responsible, this it'll be very hard to stop.
Yeah,
stop the virus.
look, but Stan, it's in a way disappointing that even those that we've asked to self-isolate, they're breaking the self-isolation, you know. And now we have a lot of people that have come back and have actually been true to the cause. They've actually self-isolated themselves. I saw a tweet by His Excellency Sojilo, the European Union head of delegation. And you know, he tweeted our staff with coming over to actually see his son, because he's in self-isolation at home. And you know, he was thankful that they came to actually visit them and visit the son at home. That's the level of responsibility that we need to take. And personally, I'm glad that you know, being a leader himself, he's being able to make it public that he himself is following the regulations of our sovereign nation, Fiji, and what we need to do to be able to protect our people. You know, so and there are many others. For example, right. Some of my good friends. One of my good friends is, he told me that he's put his child away in another institution so he can, make sure that he's actually self-isolating.
All right. So so you're confident that you're saying what needs to be said, and that all there is to it in terms of the statements that you've made.
Lives are at stake.
Lives are at stake.
Stan?
Now you did mention that we need everyone to drop the stigma about being tested. So is there a possibility are you seeing that possibility, that there are people who are worried about the stigma and not coming forward?
At this moment in time, I think if I look at the 368 that we've tested, we've had nothing of major concern. So, people have identified themselves, or we've identified Fijians and said, look, sir, madam, you need to be tested. And they've been, obviously willing to be tested. And, we've done 368 and 5 have come back positive. And the other 367, for example, have been negative, so as to speak. Now, what we were talking about is the fever clinics. We need people to utilize the fever clinics, because the fever clinics is a way in which we continue to gauge whether there's a small likelihood of a community transmission, or it's still the important case and the clusters that comes within. So you understand what I'm saying? Okay. At the moment we have clusters, so it's based on an important case. We've got one important case and the clusters. What we're trying to find is
anyone outside of the cluster.
Outside of the cluster, that means we've got a community transmission.
Yeah.
So that's why we need to have much uptake.
And that really is one of the big things out there that we don't know about.
Yeah. So we need to have greater uptake of our fever clinics, So that's the concern that we have. So there are certain geographical locations, Lautoka is one of them, where we need to use the fever clinics more. Now there may be several reasons for it. Certainly we are a very mobile country, so a lot of people, they may be here. We also, and maybe there were some people in Lautoka, they were not in Lautoka during the time of the containment, so maybe we are overestimating. We're not really sure the variables around it.
Okay.
What we do know is because we've identified that we have low uptake of the fever clinics, that we're asking people to actually use the fever clinics. They got fever, flu, need to use it.
So we have 2 clusters that you say. So essentially, have you ruled out a cluster forming from that New Zealand patient, the one that was tested in New Zealand?
Every day it becomes, it drops a little bit, and every day it reduces the chance that we may have a local cluster based on the New Zealand case. What we are worried about is the New Zealand case actually picking it up from here.
Okay.
So, picking it up. And too close to Comfort because he was around 90 and then went to Rakiraki.
Yeah,
too close to Lautoka.
Some pretty heavy
and again, too close to
areas.
Lautoka.
Yeah.
So you can deduce many things from it.
Right.
Is there any relationship between the Lautoka containment and the fact that he picked it up from here? You can deduce so many things. But with due diligence, that's why the Lautoka containment has been increased, but we are carrying on specifically, intensively in finding the context around that cluster based on the New Zealand case.
We've covered quite a lot, and I just want 2, 3 more questions. Please indulge
That'll be
me.
nice, just one more.
Now, so what are the calculations? You've moved the lockdown to Tuesday, 7th April. That'll be almost 3 weeks, for Lautoka on lockdown. So from there, then what will be the signals you're looking for? When can we expect life in Fiji to get back to normal?
I think, Stan, your question is always about Fiji. You need to look at what's happening around the world. Because what's happening around the world, there's one important thing that Takeshi Kasai, the regional director of WHO in Manila said. He said, no country in the world can say they're doing everything right. Because no country in the world has had COVID-19 before.
Right.
Okay, so with measles, we can say we're doing everything right. Because we had measles in 1875, we had measles in 1930, we had measles in 1970. So we can say we're doing it right now because we learned from our mistakes. We know what happened then, and we know how to save lives. And we did it, So 1875 we lost 40,000 Fijians. 2019, no Fijian life was lost, even though we had 28, and some of them were very, very sick and needed ICU care. So we can say confidently that we've learned. We know how to treat measles. Now, Takeshi Kasai said no country in the world can say they're doing it right because it's all COVID-19 this is the first time around people have had it. What is most important is that they say we are looking back at all the things we're doing and we know we haven't done anything wrong. Okay? So nobody at the moment can actually project and say confidently this is going to happen.
Okay.
And even countries, high-income countries that we look towards, you look at them, some of them, the graphs are still going, Some of them are, there was recently some concerns is are we going to get a second wave?
Right.
Are we going to get a second wave? And that's one of the concerns that some of the experts are having with some of the countries that had an earlier takeoff.
So what I'm hearing from you is that this is going to be a long, tough ride ahead for the people of Fiji.
Around the world, globally, every country in the world is facing challenges with COVID-19. Whether they're high-income countries or a developing nation or low-middle-income country that is actually dependent on this, we all face the same challenges. So I think that's important to understand. So it's not something localized to Fiji. It's a global thing. It's a global health problem. That's why it's called a pandemic. That's why the advice coming from WHO has been very strong, that countries need to be very stringent, that countries need to pour resources into it, that countries need to save lives, and we've done exactly what they've said. Even WHO cannot predict. All the experts that I've read so far, done so far, a lot of them have been debunked because of their predictions. Some countries have said we'll have it for 3 months, we'll be over and back to business. That hasn't happened. We also have to understand that there's concern, as I've said earlier, about, is there a second wave? What we do know is that the vaccine won't be available until for at least another year, So
harsh reality.
that is the reality. What also we know is that we as a Fijian people have resilience. That's one thing that I continue to say. We are brilliant, we are wise, we are smart, we have resilience. We faced many storms before. The latest that we faced is Tropical Cyclone Winston, and we survived. And maybe other countries need, so many mechanisms to make them survive. I'm not so sure about that, but what I do understand is that we have strong leadership, we have strength of character, and we have the mechanisms to continue to do well.
We have to dig deep.
Yeah.
We have to dig deep and dig deep into the Fijian character to survive all this. Now, I follow you on Twitter, and a lot of your tweets are about encouraging people. I note that, and also advising people about the right things to do, what needs to be done. You also are highlighting the ministry, your team, your hardworking team, Dr. Shalini, every you've been mentioning names. And we are all grateful for the hard work and the sacrifice that they are doing. So your message, as we close this show, your message to them and to the country at this time.
Thank you, Stan. You sound very emotional now. But anyway,
I feel very somber after listening to all you've had to say, Minister.
No, I mean, I see, so much opportunities. I think I see so many opportunities. I think there's opportunities to see the deepness that we have as a people, the opportunity to see, as I keep on saying again, the wisdom and the brilliance that we have. Look, we have so many Fijian people all over the world, working in many high places, and also because of our hospitality, the hospitality industry, British Army and so forth. And that just shows the caliber and the resilience that we have as a nation. And I see us, becoming better after this. As I've said before, we have, very strong and capable leadership in the Honorable Prime Minister and, Cabinet and us that surround him. But also, more importantly, with the open merit system that we have now had in the civil service, we are having the right people at the right place to be able to take forth the policies of government. And, I'm really proud of them, really proud of the fact that they can come together. They can actually, work together in this, challenges that we've had. We've done it before with Tropical Cyclone Winston, and again, showing it again now. It's as bad as Winston in a way that it's affecting us, and we have to understand that that's a challenge that we have to face together. And it's one of those. So, we faced challenges as a nation before. This is just another challenge, another storm. And we've weathered so many storms before. We'll weather this one and become better. All right,
Dr. Waqainabete, thank you for joining me on the show.
Nawalebu, thank you.
That was the show for today. Join us again next Thursday at the same time. Good night.
This program was brought to you by Colgate. Brush twice a day for strong, healthy teeth.